The setup screen. Touch the load button to automatically load the pump loop. The Ready screen play button. A play button appears on the Ready displet or display applet in the middle of the screen. Click the play button to start the process. The Ready screen vacuum displet. When the XVac vacuum module is installed, the vacuum displet appears in the lower left corner of the displet area. The XVac vacuum module is controlled by the vacuum displet. The Ready screen red blood cells displet. The red blood cells, RBC, displet is always present and located in the upper right corner of the displet area. It contains two fields, one which displays the total volume of red blood cells transferred into the RBC bag during the current case, and another which displays the average hematocrit of the total red blood cells collected in the RBC bag during the current case. The Ready screen waste bag displet. When present, the waste bag displet is located in the lower right corner of the displet area. It displays the volume of fluid currently in the waste bag. The Ready screen start processing. Touch the play button to begin the fill phase. One should ensure that the blood in the reservoir is regularly mixed to prevent sedimentation and to ensure that the anticoagulant is well dispersed. The auto start function is on. It is always on in the one-touch mode and available as an option in the automatic mode. If auto start is active, then it is not necessary to touch the play button. The fill phase will begin processing automatically once the reservoir contains the program auto start volume. The processing screen, fill screen. As blood enters the bowl during the fill phase, centrifugation concentrates the red blood cells into the bowl while supernatant components are expelled to a waste bag. This continues until the buffy coat is detected, which indicates that the bowl is properly filled with red blood cells. The volume and hematocrit of the blood pumped into the bowl are displayed on the processing displet and constantly updated by the system software. Modifying parameters. Except when the system is processing with a POPT protocol, the fill pump speed may be adjusted from the text box. The processing screen, wash screen. As the saline solution enters the bowl, it displaces residual supernatant and its contaminants and is then expelled into the waste bag. During the wash phase, the volume of the saline solution pumped into the bowl is displayed on the screen and constantly updated by the system software. The desired total volume of saline solution to pump, as well as the wash speed, can be adjusted from the processing text box. The processing screen, empty screen. When the empty phase begins, the pump rotates clockwise again to move the red blood cells from the bowl to the RBC bag. The volume and hematocrit of the RBC transfer from the bowl are displayed on the processing displet and constantly updated by the system software. The empty speed can be adjusted from the processing displet. The Ready or Processing screen, emergency button. The emergency function can be activated at any time from any screen. From the emergency activation screen, the operator may select from 3 emergency options: emergent processing, no wash, or rapid transfer. In the emergent processing option, the pump speed is increased during fill, wash, and empty phases. In the no wash option, the red blood cells in the bowl are concentrated but not washed. In the rapid transfer option, blood is pumped from the bowl to the RBC bag without being concentrated or washed. Press play to confirm emergency activation, or X to exit and display the current screen. The emergency function increases the pump speed during all phases. The menu button. Touching the menu button from any screen displays the menu screen, which consists of a list of tabs. Touching one of the tabs will display the associated menu screen. The processing screen special button. Touching the special button from the Ready screen displays the special cycle screen, which allows independent access to the return, concentrate, purge, and prime IV cycles via the buttons in the button bar. By touching the return button, the blood in the bowl is returned back to the reservoir. When there is insufficient blood volume in the reservoir to complete the full phase of a cycle, the concentrate button may be touched to complete filling the bowl from the RBC bag. By touching the prime IV button, wash solution is pumped into the bowl and then directed to the blood collection bag to simplify priming the reinfusion line. The purge button. It is normal for air to accumulate in the RBC bag when processing several units of blood. By touching the purge button, step-by-step instructions for purging the RBC bag of air are prompted. The end of case screen. The end of case screen appears after touching the end case button from the Ready screen. From the end case screen, the operator may empty the RBC line, export and print the case tally data for present and past cases, and unload the pump loop. The vacuum displet is the only displet present in the end of case screen. Pressing the unload button will end the case and allow for the teardown of disposables. The 3 standard protocols. Protocols represent specific parameters of processing blood in order to obtain blood components. A protocol defines a processing cycle which may be run 1 or more times in a case. The Xtra system comes with 3 factory-defined intraoperative protocols: 2 for the concentration, washing, and collection of red blood cells, the POPT and P-standard protocols, and 1 for enhanced fat particle removal, PFAT. The P-standard protocol. P-standard is the protocol of choice and is designed to achieve maximum red blood cell concentration and wash quality in a short processing time. Because P-standard offers the best compromise between hematocrit, processing time, and wash quality, it is the most commonly used protocol in the U.S. The POPT protocol. POPT is a protocol designed to achieve the highest possible hematocrit with an excellent wash quality. In order to achieve a higher hematocrit, the protocol runs longer than the P-standard protocol to complete a full cycle. Another trade-off is that a higher number of red blood cells may be lost in the process. The POPT protocol is a substantially automatic protocol where operator intervention is significantly limited. The PFAT protocol. The PFAT protocol should be used when fat is observed in wound blood and also in processed red blood cells during orthopedic and heart surgery. The PFAT protocol was developed to remove fat particles while maintaining a good compromise between hematocrit and wash quality. Right after the regular wash phase, an additional quantity of saline solution is pumped into the bowl at a high flow rate. This process eliminates the residual fat particles left inside the bowl. Due to the additional wash volume required, this protocol takes longer to complete. The emergency protocol. The emergency function uses a special variation of the P-standard protocol intended to minimize the operator's interventions and the processing time in case of an emergency situation. If the no-wash option is engaged, a normal fill and empty occur, but the wash phase is skipped. Normal hemoconcentration is achieved. The rapid transfer option will send everything that is in the collection reservoir to the transfer bag via the bowl, without any hemoconcentration or wash. Introduction to setting up the Xtra ATS for collection and processing. Intraoperative blood recovery is generally indicated in all major surgeries with an anticipated blood loss of greater than 2 units. This is the level at which autotransfusion becomes a cost-effective and viable option to return the patient's own red blood cells to assist in avoidance of red blood cell transfusion. To set up the Xtra for collection and processing, you will need the following components: a collection set, which includes a filtered reservoir, a vacuum extension line, and an aspiration line; a bowl set, which includes a centrifuge bowl in the selected size, a tubing harness with pump loop cartridge, a 10-liter waste bag, and a 1-liter primary RBC bag; a bag of anticoagulant solution, and a bag of wash solution. The most convenient option to order Xtra disposables is the procedure set, which includes all of the necessary components to process in one package. That is, the collection set and the bowl set. This table summarizes the different procedure set configurations available with the corresponding catalog numbers. In this video, we will show you how to set up the Xtra for collection and processing and run the basic functions of the machine. Swing open the reservoir holder and raise it to the desired height. Keep the locking clip on the reservoir holder open. Slide the edge of the reservoir lid into the slot of the holder and push the reservoir into position. Close the clamp on the bottom outlet line. It will be reopened when connecting to the prime line of the bowl set when it is time for processing. Open the vacuum extension line package and, using aseptic technique, attach one of the yellow capped ends of the vacuum line to the yellow capped vacuum port on the top of the reservoir. Placing the vacuum line in the groove on the handle prevents weight from being added to the reservoir, which can interfere with the auto start feature. Attach the other end of the line to the overflow trap of the XVAC system. Power on the Xtra using the power switch on the back of the unit. As soon as the display on the XVAC lights up, you may power up the XVAC using the power switch on the XVAC module. Once the Xtra is fully booted, and if the vacuum has not been powered on from the module, touch the vacuum button on the touchscreen interface to activate it. Pass the aspiration and assembly line to the sterile field per hospital protocol and receive the split end from the sterile field. Attach the tubing of the aspiration and assembly line to any of the 3 1/4 inch ports on the top of the reservoir. Close the roller clamp on the small bore tubing and, using aseptic technique, spike the anticoagulant solution. Open the tray containing the bowl set. Open the centrifuge lid and swing open the centrifuge arm. Unlatch and open the clamp lid latch. Remove the bowl and associated tubing from the tray. Remove the protective spacer from the upper part of the bowl. Tilt the bowl away from the machine, lower the bowl onto the turntable, and push the bowl straight down. Line up the pump loop cartridge by inserting the guide pin into the opening and pushing down. Close the clamp lid latch and lock it. Close the centrifuge arm by swinging it forward and insert the waste line into the wash quality sensor. Close the centrifuge lid. Connect the blue-striped fill line to the reservoir outlet port and ensure the reservoir outlet clamp is open. Hang the wash solution bags on the hooks provided. Remove the RBC bag from the tray, making sure the connection from the RBC bag to the RBC line is tight. The connection may sometimes loosen during shipping of the disposables. Then, close the clamps on the 2 other lines of the RBC bag. And hang it on the upper hanger of the IV pole. Close the slide clamp of one of the two yellow wash lines and spike the wash solution with the line left open. Pull out the waste bag from the tray and remove the tray. Hang the waste bag on the two lower hangers and connect the waste line to the waste bag. Ensure the waste bag drainage port is completely closed. With the XVac system on, open the roller clamp fully and allow a minimum of 200 milliliters of anticoagulant solution to be drawn into the blood collection reservoir. Touch the load button to automatically load the pump loop. The system performs a series of checks during the autoload procedure. If auto start is active, then it is not necessary to touch the play button. The fill phase will begin processing automatically once the reservoir contains the program auto start volume. If auto start is not active, press the play key to initiate processing when the desired amount of blood has been collected. One should ensure that the blood in the reservoir is regularly mixed to prevent sedimentation and to ensure that the anticoagulant is well dispersed. As blood enters the bowl during the fill phase, centrifugation concentrates the red blood cells into the bowl while supernatant components are expelled to a waste bag. This continues until the buffy coat is detected, which indicates that the bowl is properly filled with red blood cells. When the wash phase begins, the centrifuge continues to spin and the processing displet changes to reflect that the wash phase is in progress. During the wash phase, the volume of the saline solution pumped into the bowl is displayed on the screen and constantly updated by the system software. When the empty phase begins, the pump rotates clockwise again to move the red blood cells from the bowl to the RBC bag. The volume and hematocrit of the RBC transfer from the bowl are displayed on the processing displet and constantly updated by the system software. From the end case screen, the operator may empty the RBC line, export case tally data, and unload the pump loop, which allows for the teardown of disposables. The machine can then be powered off.